We have our special guest with us for our last segment. She's a Justice Democrat running for Congress in Nevada's 4th District. So great to meet you. Now, tell us your story. Now, how did you get interested in running for Congress? How did you become a political person?
You know, my entry into activism, it came on the heel of my daughter's death. I remember I went through a year where I just stayed at home and I didn't want to re-enter the world. It was the most crushing thing that's ever happened to me. And, you know, I was filled with anger and a real sense of, I don't even know where I live in anymore, because this isn't the America that, you know, I've been raised or thought that I was a part of. And eventually, you know, my husband, who is from Brazil and is very familiar with single payer, started talking to me about, you know, there's this thing called single payer, Amy. Most countries have health care, and it's not based on your job or your economic status. And I was like, what? You know, like most Americans, we don't know what that is. And so I went to a single payer conference and met the amazing Nina Turner and heard her talk about, you know, all the bones you have to have. And I remember her telling me, you know, you have to dig really deep. You have to fight. You got to, you know, really dig deep and fight this. And I decided that, you know, I was going to find the mercies and blessings in my daughter's passing, and I was going to fight the powers to be. And I was going to fight to ensure that no other American or anyone living in this country dies from something as simple and basic as health care.
Amy, can you share a little bit about how our broken healthcare system contributed to the death of your daughter?
Yes.
I think that, I mean, if it's not too painful, I think people have to understand that there are real consequences to our healthcare system. It's not just, oh, it's gonna cost a little bit of money, or no, people die. And families are shattered and people are broken because of this. And, you know, in the greatest, or, you know, allegedly the greatest country in the world with incredible wealth, the fact that people are dying on a daily basis because of healthcare, to me, it just shocks the conscience. It's immoral in every way. So you can share that a little bit.
Sure, it is very inhumane. And you know, my daughter was 22 years of age. She had just moved to Las Vegas. We just had moved there ourselves, and she decided for some reason she wanted to move out to Vegas. And she was going to school to become an RN, and she had just enrolled in school. She was working 2 jobs as a CNA and was very self-sufficient. When she arrived, she had a red swollen leg. And we thought it's just from driving, you know. I was a CFO, not in any medical field. And I thought, well, you know, give it some time. This should take care of itself. It continuously got worse, and then she fell. I was out of town and I got a call, could hear her screaming, and they went to the emergency room. And, you know, we do have a law in place called EMTALA that requires them to see you, but they have found ways, because they're profit driven, to work around that and give what's called wallet biopsies. They almost do their medical exams so as not to find anything. So she presented with a red swollen leg. My daughter was half African American. She had sickle cell trait. She was a casual smoker. She had an injured knee and just driven 22 hours. They were all signs and symptoms of a blood clot. They immediately asked her when she got there, you know, do you have insurance? That's the first phone call I yielded. And I'm like, why are you calling me on this? Like, we'll deal with this later, just be seen. They had my husband calling up TRICARE, which he's in the military. So most people don't know that military personnel and active duty people are not covered the same way civilians are. Our children are not covered between the ages of 21 and 23 unless they are actively enrolled. And as she had just enrolled in school, this is how silly and ridiculous it is. And the semester had not started. She would not qualify to be on that insurance. She went in the back. I got another call. This time she's crying. And she's, Mommy, they're not helping me. And she begged for something for the pain and for some testing to see what was wrong with her leg. They told her specifically, go get insurance and see a specialist. We're not a doctor's office. And my daughter left there thinking that it was just something that she would have to do as soon as she could secure insurance and see a specialist. I had to do what no parent should have to do, and I had to hold her. She died in my arms of a pulmonary embolism. And it was totally unnecessary. And it was totally because as a CFO, I can tell you, I understand completely what goes on behind the scenes. They're doing risk management. They're talking about, patient payer mixes and how much they can afford of what type of, insurance. And just because you have insurance doesn't mean that it's a gold tier insurance, and you could still be susceptible to being discriminated against. And Shalene's not a one-off. She's not the first, and unfortunately, she won't be the last until we get people who have some guts and some balls into Congress and into the Senate and stand up for the American people and get profit out of healthcare.
If you enjoyed this clip of Aggressive Progressives, you know there's a 90-minute show waiting for you at the Young Turks Network. Go to tytnetwork.com/join to see all our content.